Hi everyone, I am Dr. Nagarjuna Maturu. So today is a very special day for us because we are launching our specialty clinics in pulmonology. So pulmonary medicine is, I would say, the fastest growing specialty in amongst all the specialties in medicine, and as we have seen, there is a huge increase in the number of respiratory diseases, be it infections, be it allergies, asthma, ILD, cancers. So every disease seems to be on the rise. So now we have come to a time where we need to have a more focused approach for each of these diseases, and that is the precise reason why we are starting off our specialty clinics in pulmonology. So we are starting with our severe asthma clinics and the ILD clinics from today. So every week, one particular day on Thursday, we will be having severe asthma clinic, and on Friday we will be having our ILD clinics. So how are these specialty clinics different from our routine OPD visits or the OPD clinics? So in these clinics are what I would call different in 5 ways. First is there is a comprehensive analysis. So each patient we spend more time. Unlike in the routine OPDs where there is a time constraint, in the specialty clinics, each patient will a detailed history, analysis, examination, investigations will be done. So there will be a complete comprehensive analysis. Then second is a structured approach. So how is the difference? So for each of these clinics, we are having a dedicated structured protocolized approach, so that nothing will be missed. As opposed to a routine OPD where sometimes because of lack of time some things can be missed. So we follow a very structured protocolized approach, and we have dedicated performers for each of these diseases. The third thing is the multidisciplinary concept. So most of these diseases now require the need of more than one specialist. So in our specialty clinics also we have dedicated counselors, we have pulmonary rehabilitation people, we have a dedicated lung transplant team. Whenever required, they'll offer their services, and we also have formed a concept of multidisciplinary analysis for each of our patients, be it asthma or ILD, and pathologists, radiologists, ENT specialists, everybody will be involved whenever required for our patients in these specialty clinics. Fourth, access to the best of the investigations. Every year new tests are being launched, and we at our center have the access to each of these specialized investigations. We have advanced lung function testing, we have pheno impulse oscillometry. So the asthma patients or ILD patients can have a very focused and detailed lung function testing. We also have access to bronchoscopy, minimally invasive biopsy techniques, wherein patients with ILD can get a histopathological diagnosis. So the fourth difference is that the patients will get access to the best of the diagnostic tools which are there, and most important, access to the best treatment options. Pulmonology, as I have said, is a disease which is expanding. Every year new drugs are being introduced, new therapeutic techniques are being introduced. So at our center we have the expertise with most of these newer drugs, newer medicines and newer techniques. For example, if a person of severe asthma comes who is not responding to the conventional therapies, we can offer them biologics, we can offer them thermoplasty. Similarly, patients of ILDs where people are not improving, then we can always give them the newer medicines which are available. We can also offer them lung transplant program. So basically these specialty clinics will help us having a comprehensive, structured, multidisciplinary approach, and the patients will have access to best diagnostic modalities and best treatment options. So we have called them the precision clinics for pulmonology. So basically now the concept is every person is unique. So even in asthma or ILD, each person has to be treated separately. So what we want to do in our specialty clinics is called precision medicine. So we want to identify each person by his characteristics, identify his problems, his traits, and then give the correct medicine to that particular person. So our aim is to get the best, to deliver the best healthcare so that the patients and their outcomes will improve. Thank you.
Thanks Nagarjuna for the detailed explanation of the clinics. Just a brief introduction about myself. My name is Dr. Pavan Goruganti. I'm basically a pulmonary critical care doctor myself. By training, I was from Maimonides Medical Center in New York. Since 2018 relocated here, but from 2018, I'm mostly in the alternate hat of into the administration, like I'm a director of the hospital and mostly in charge of the administration. But I feel very proud of all the pulmonologists in our group in particular, and in general all the doctors for taking care of this COVID once in a lifetime pandemic of this first wave, second wave. Second wave was especially busy. We had 350 critical care patients, 350 plus critical care beds, about 200 ventilators, 100 air ambulance transfers, 20 to 25 ECMOs simultaneously. That kind of busy. Each of our doctors here were seeing about 100 to 200 patients every day. I don't even know how is that humanly possible. So I congratulate them, and despite their busy schedule in COVID care and all, especially proud that they are not neglecting the other pulmonary diseases. Even now in India, asthma and interstitial lung disease is grossly underdiagnosed and I would say undertreated. So the first step is identifying appropriate patients. For that, as a first step, we'll having specialty clinics wonderfully organized by our pulmonary team here. And asthma itself, we have many advances in the treatment. First of all, beginning with the diagnosis, and as Dr. Nagarjuna explained in detail about what we do in the clinics and all. Some of these techniques like bronchial thermoplasty, even in US, very few centers do it, and I feel very proud that we are doing the highest numbers in the country. And not everybody may be a candidate, but for those selected candidates, once you get evaluated, it's a great solution, without being on steroids or steroid sparing or reducing kind of medication, which will make a huge difference in their life. And interstitial lung disease too, nowadays it's become more popular after the COVID episode. Many of these COVID patients end up in fibrosis, causing somewhat of interstitial lung disease. But even without COVID, there is a huge burden of interstitial lung disease, and I think this is a very debilitating disease for many patients. It needs early diagnosis. A lot of new medications have come in the market, and new techniques of treatment too. So once again, all of these things we are offering in a specialty clinic, so that a multidisciplinary team will work on this latest diagnosis, equipment, treatment, and all of these other options, which will make a huge difference in the patients, beginning with just the basic counseling to inhalers, going on to bronchial thermoplasty, cryobiopsy, and all the more complicated stuff, and even at the extremes, lung transplants too. Nowadays we are doing about the highest number of lung transplants in the country, and I mean, for selected patients, that is a last chance too. So I would once again congratulate all our pulmonary team, led by especially for Dr. Nagarjuna, Dr. PNS Reddyyaru, and Dr. Raghutam, Dr. Chetan, and all of the team here in Somajiguda to take this time in this busy schedule when pulmonologists are super busy among all of these other consultants, to organize a great clinic. And I'm sure a lot of patients will be benefited. And if you think you will have any kind of questions or queries, we are always available, all of our doctors, and we are available with on phone, mail, or website, any of these things. Please make use of our services. Thank you.